room scan. Hi, my name is Jenna. I'm your nursing student. Can you please verify your name and date of birth?
Madison Schneider, 51405.
Okay, I'm just going to get your wristband. Provide hand hygiene. Provide privacy. Do you have any allergies?
No.
Okay. Today I don't feel the need to wear gloves or PPE. Your provider ordered a neurological assessment, so I'm just going to be inspecting and palpating, make sure everything looks and feels okay.
Okay.
Do you have any concerns?
No.
Alright, first I'm just going to gather and cleanse my equipment. Are you in a comfortable position?
Yep.
Alright, so first I'm just going to have you repeat 3 words back to me. Blue sock bed.
Blue sock bed.
Okay. And then you already told me your name and date of birth. Can you tell me where we're at
Southwest Tech.
and why we're here?
A neurological assessment.
Okay, so you're alert and orientated times 4. And then can you repeat those 3 words back to me?
Blue sock bed.
Good. So first I'm just going to inspect your head. I'm looking for size, shape, and symmetry. That all looks good and normal. Next I'm going to palpate your head for masses, tenderness, and infestations. None of that seems to be present. That's good. Can you smile for me? Okay. So your expression and symmetry is good. And then I'm going to have you close your eyes, and when you feel me touch you, say now.
No. 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 No.
Good. And then can you move your jaw side to side? Good. Alright, now we're going to move on to the eyes. First I'm just inspecting your iris and pupils, and those look good. And next I'm going to have you close your eyes. I'm looking at your eyelids for edema, lid lag, and lesions. Good. And then I'm going to have you pull your eyelids down, and I'm looking at your conjunctiva for contour, moisture, and color. That's good. And then next I'm looking at your sclera for color and lesions. Looks good. Next I'm just going to look at the side at your cornea and lens for color and lesions again. Good. And then if I can look at the other side. Good. And then next I'm going to do your pupil constriction, so just look straight ahead. Okay, and then the other side. Good. Alright. And then next I'm just going to have you follow your eyes with my hand and don't move your head. Good. Next I'm going to palpate your globes for any tenderness. Does that hurt at all?
No.
Okay. And then I'm going to have you close one eye first. And can you tell me what that says?
Gel.
And then can you tell me what that says with the other eye closed?
Hand.
Good. Alright, so that's everything with the eyes. Next we're going to move on to your ear. So first I'm just looking at your external ear for the color, shape, symmetry, size, drainage, lesions, anything like that. And there doesn't seem to be anything concerning with that. Next I'm just going to palpate your ear for any tenderness. Good. And then next I'm going to look inside your ear with the otoscope. I'm just looking for redness, swelling, drainage, any signs or concerns of like infections. For an adult, you pull the ear up and back, and for a child, you pull down and back. So the characteristics are good. The hair is normal. There's no redness, drainage, swelling that's concerning. That's good. Just look in your other ear. And same with that. Nothing concerning. then next I'm just going to whisper behind you and you repeat what I say.
1, 2, 3.
Okay. And the other side.
4, 5, 6.
Good. Alright. Alright, so that completes the ear. Now we're gonna move on to nose. I'm just looking at the outside of your nose for any lesions, drainage, symmetry. That all looks good. And then I'm gonna have you put your nose up. Here I'm just looking for, good, any bleeding, disformities, lesions, color, make sure all that looks good. Next I'm just going to palpate your nose for any tenderness or disformities. Good. And then I'm going to palpate for tenderness, your maxillary sinus, any tenderness here,
No.
and your frontal sinus. Good. And then next I'm just going to have you close your eyes. I'm just going to have you close one nostril as well and tell me what you smell.
Alcohol wipes.
Yep. And the other one.
Same.
Okay. So that completes the nose. Now we're going to move on to the mouth. First I'm just looking at your external mouth to make sure everything's intact and looks good there. Next I'm going to look at your lips. I'm looking for lesions, any like cracks or the moisture, the color. That all looks good. Moisture looks good. Next, I'm going to have you open your mouth. I'm going to look at the inside of your cheeks for color and moisture as well. Good. Good. And then I'm going to have you bring your lips down. I'm looking at your gums for edema, bleeding, the color. Make sure all that's good. That's good. And that's good. No signs of any of that. Next, I'm going to have you stick out your tongue. I'm looking for moisture, lesions. Good. No signs of that. Can you say light, tight dynamite?
Light, tight dynamite.
Good. And then I'm going to look at the floor of your mouth. You can lift your tongue up here. I'm looking for color. That's normal. And then if you can open your mouth and say ah, I'm going to look at your uvula and your tonsils. Good. Your uvula, I'm just looking to make sure it's intact, and your tonsils, I'm looking for size. And then if you can open your mouth again, I'm going to look at your hard and soft palate. Good, make sure that's intact, and it is. To test or palpate your hard and soft palate, I would have a finger glove to palpate it, and then to do your gag reflex, I would have a tongue depressor, hold it to the back of your mouth to test your gag reflex. Okay, next we're gonna move on to your neck. So first I'm just looking for symmetry. That's good. And then range of motion, if you can move your head side to side. Good. Next I'm going to palpate your lymph nodes. So first I'm starting with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, and then your superficial anterior cervical. And then if you can turn your head, your deep cervical, posterior cervical, and then your supraclavicular, and that's all good. Alright, do you have any concerns before I go?
Nope.
Do you need me to do anything else?
Nope.
Okay. So first I would gather and cleanse my equipment and take it all out with me. And then I would make sure you're in a comfortable position, you have no concerns. I would make sure the bed's low and locked, side rails are secure, call light in place, side table near, and room risk-free of falls. I would provide hand hygiene, the 5 stages, before a patient, after a patient, before a procedure, touching bodily fluids, and touching patient belongings. I would report any norms or deviations per agency policy, and I will document my findings in OneNote. And if you don't have any concerns, I am going to go. Thank you.
Thank you.